Stories from the surge. Frontline workers are sharing their tales of dealing with coronavirus cases and deaths as another crowd gathering event draws near.
Yeah, they hope their stories will dissuade you from turning Super Bowl Sunday into a super spreader event. They spoke to CBS 2's Rachel Kim.
In the ICU, you do deal with death and dying, but not at this level.
It's very difficult to see the fear in people's eyes when they require that level of attention and fearing for their lives.
They're looking for that guarantee that yes, they will be okay.
On this busy day at Kaiser Permanente Downey Medical Center, these 3 frontline workers took time to share their experiences during the height of the COVID surge from December to January. Dr. Praveen Acharya tells us they were inundated with critically ill patients with respiratory distress in the emergency department.
Oftentimes we'd have to see patients right out of the waiting room. They couldn't be bedded because we had no beds. And we would often discharge them with oxygen and home monitoring.
Was this a different level of sickness and suffering that you saw with COVID patients?
Absolutely.
ICU nurse Alicia Padilla watched patients deteriorate very quickly, from oxygen support to intubation to the final moments. Padilla says nurses are many times the only and last face a patient sees. She's had to help families say goodbye through an iPad too many times.
For you to be there as the person that they are with, and reassuring the family that they are not going to be alone, that you are there with them, holding their hand while they are watching the family member take maybe their last breath. It's really mentally very taxing and very emotional for the nurses.
Although the number of new coronavirus infections and hospitalizations have been recently going down in LA County, health officials say we can't let our guards down. With the Super Bowl coming up this weekend, they're urging people not to gather for parties. They don't want the Super Bowl to become a super spreader event.
Many of the patients that I'd seen had mentioned how they were together with family or friends and they contracted the disease from someone who had no symptoms. And when they arrived, they had to nearly get on a ventilator.
Nursing department manager Myrna Diaz has not only seen patients lose their lives from COVID complications at work, she's lost family members as well.
We want to also stay safe as nurses because we also have families and we want to be there for them. We want to be here for our patients, but we need everyone to do the right thing.
It's really difficult to see that the community does not do something simple like just wear a mask and believe that this is really real, this is true, and people are dying.
We are not out of the woods, and we have to do our part as individuals to slow the spread.
Reporting from Downey, Rachel Kim, CBS 2 News.